mute actually. Um, so I would just start. All right. Good evening, one and all. Welcome to our podcast. I'm Radhika Dhaya, your host for the day, and the team's executive at PsyConnect. Today, we are taking a significant leap forward in May Mindscape as we embark on a journey of knowing about mental health for marginalized communities. India, with its rich diversity of cultures, languages, and traditions, is also a nation grappling with social inequalities. Amongst these, the mental health crisis within marginalized communities stands out as a silent yet pervasive issue. From caste based discrimination and economic disparities to gender inequality and ethnic biases, these communities face stressors that are significantly impacting their mental health well being. In this episode, we will unpack the multifaceted nature of mental health challenges faced by the marginalized groups in India. We'll hear from an expert in the field and discuss the systematic barriers that prevent many from accessing the care that they need. We'll also explore the role of initiatives aimed at bridging the mental health gap. For all those wondering about the relevance of this podcast, the reason to have this podcast is that to effectively support marginalized communities, therapists must be well informed about the unique cultural, social, and economic context these groups navigate. Understanding the economic and systematic factors contribute to the mental health challenges and is a very crucial factor. This includes recognizing the impact of stereotypes, discrimination, hardship, biases, and marginalization on mental health well being. Therapists should also be aware of the practices and community support structures that play a significant role in these communities. So, join us as we shed light on this crucial subject, breaking the silence and fostering a deep understanding of mental health landscape for marginalized communities in India. It's time to listen, learn, and amplify these voices that too often go unheard. Before we start the session, I would like to inform you all that the mics and videos of the participants would be turned off to avoid disturbances during the podcast. Participants would get a chance to put forward their questions and interact with the speaker at the end of the session. Meanwhile, you could put your questions in the chat box if there are any, and they would surely be addressed. Now, moving forward, I'm extremely delighted to introduce to you all today's speaker, Ms. Sudhanya Roy Chowdhury. We are grateful to have you, ma'am. Thank you for giving us an opportunity to connect with you. Sudhanya, ma'am, is a RCI licensed clinical psychologist, queer affirmative mental health professional, human rights enthusiast, a mental health advocate, and an assistant professor of psychology in Adamas University. I don't think that there is anyone better to facilitate this podcast rather than you, ma'am. So thank you for joining us. Do you have anything to say to our to our listeners today? Ma'am, you're on mute.
Thank you so much, Radhika, for this wonderful and kind introduction. Thank you so much, and welcome all of the participants. Now, you can ask any question if you feel like that you need to ask that. There is nothing like should I ask that? Obviously, you should. If anything comes to your mind, you can ask. Okay, and I can speak English, Hindi, Bengali. I am fluent in Bengali. Obviously, it's my mother tongue. I can speak a bit Hindi and I can speak a bit English. So you can ask me in any language. Okay, I will try to answer you in English. Okay, mostly in English because it is accessible to all of you, I guess. So, but you can ask it. Any question in your own language. You will try to first interpret this in English so that everybody can understand, and you can ask in any language. So there will be no language barrier. Okay, so you can feel free to ask anything, and we can start, Radhika.
Thank you so much for setting the stage with an introduction of inclusivity, starting with the languages. And I think this is a really nice step towards the podcast. To begin with, first things first, it's essential for our listeners to have a basic understanding of today's topic. So, let's have a fundamental question to set the stage for our discussion. So, ma'am, can you tell us a bit about the term marginalized?
Yes, of course. So there are few terms available like minority and marginalized. We used to use the. Am I audible?
Yes, ma'am, you are.
Okay, okay. So there are so many terms available which is actually used interchangeably, like minority and marginalized. But we used to use minority previously, but we have shifted to use the term as marginalized because minority is a state, so it is not related to, it is just a number. But when we are talking about marginalization, we can say the dynamics within the society of those people who are marginalized. So marginalization means it is who are the marginalized and where are they marginalized. They are marginalized in the context of society, and what are those things in which term they are marginalized, because society must be for all. In a ideal situation, society must be for all. So in terms of resources, everybody should have the equal access to it, everybody should have the equal participation, everybody should have the protection against discrimination and stigmatization kind of a thing. But few people, our society follows few societal structure and system. For example, our Indian society, we can say that it is a bit capitalist society, as well as it is when we are considering the gender, we can say that it is patriarchal. Most precisely, we can say that our Indian society is semi-feudal and semi-capital. So when we are considering the capitalism as a structure, then we can see who are having the power, those who are having the money. And if we consider another structure which is patriarchy, who are those having the power? Mostly the cis man. I will be explaining the term what is the meaning of cis man and what is the meaning of other things. Okay, so cis men are having the most power because it is a patriarchal society. So they are having the power, and when we consider the capitalism, which is also a dominant structure of our society, then who are having the money are having the most power. And these people who are having the power, I am just talking about these two structures. There are so many other structures which I will be discussing. Uh, but now I will just use these two examples so that everybody can get the understanding of the marginalization. So some people are having the power in terms of societal structure. For say, for capitalism, those who are having the money have the power, and they push other people who are not having this much of monetary power to the margin of the society, in terms of they are depriving them from having the access of resources. For example, limiting the job opportunity, limiting the educational access, this kind of thing, and limiting the medical access. Because we can understand that we nowadays it is a big deal for marginalized, who are marginalized in terms of class, to access mental any kind of health care. So we can understand that mental health or any kind of health must be accessible to everybody, but due to this capitalist structure, it is not accessible to all, because and these way they are marginalized. Okay, is it clear to you all? If it is not, you can write it in the chat section. Okay, so marginalization is when a group or a person is pushed through the margin of the society in terms of access to the resources, in terms of participation, representativeness, in terms of stigmatization, discrimination, and other things. This is the marginalization. And if we're talking about mental health and marginalization, we mostly talk about mental health in terms of three aspects. One is preventive measure, intervention, and postvention. We can consider that how marginalization actually impacts three aspects of mental health. We will be talking about it. Okay, so I think I am able to make you understand a bit about what is the marginalization actually means.
Yes, ma'am, you surely were. And thank you for being so elaborative and comprehensive with your answer. I actually learned something just at the starting, that the difference between minorities and marginalization and why that shift happened. And thank you for bringing in terms like capitalism and patriarchy to set the notion of the podcast. And I think these are like the most important terms for today's session. So, moving on to understanding the marginalized communities and their mental health experiences, my next question is, how do mental health experiences differ for individuals facing intersectional discrimination based on caste, gender, sexuality, and so on?
Hmm. So, as I was discussing about these three aspects of mental health: preventive measures, intervention, and postvention, where we need to work on the preventive measure, because we always say that prevention is better than cure. So, we always forget to say this in the context of mental health. We always talk prevention is better than cure in the context of physical health mostly, but mental health crisis can be prevented. But we dominant mental health discourse doesn't talk about this kind of preventive measure, but we can do that, because there is a high probability or prevalence of decontextualizing mental health in dominant mental health discourse. What is the meaning of decontextualizing mental health? That means dominant mental health discourse sees mental health as an individual problem, that never sees that the problem lies within the context of that individual. For example, if a person who is unemployed, who don't have the access to money, and obviously in turn they don't have the access to food, shelter, and any kind of basic things, how can that person be happy? They never be, because the basic condition of living is not available to that person. So it is the actual context which is making that person depressed, or any kind of psychological conditions which is led by this context of unemployment. So if we approach to a mental health professional, in most cases this is seen as an individual's problem, and people suggest them so many a few psychotherapies, sometimes medication, and that's it, and that's all. But if that person is employed, there is a high chance that that person doesn't develop mental health condition like depression, anxiety, or anything. So we need to understand that behind most cases, behind any kind of mental health condition, there is a huge stressor which lies in the context. Because when we are talking about the stress diathesis model, which means the diathesis means the proneness, which for example, which is the genetic proneness, that is the diathesis of the proneness, and along with this, stressor must be there before the onset of any kind of disorder. So if we can control this stressor which lies within the context in terms of employment or any other measures, and we can prevent it, because that is why we need to understand that basic employability must be there. It is easily preventable in most cases. We can talk about the form of suicide, because obviously they lack the basic thing at that point of time, so they don't find any other way, that's why they end their life. So when we are talking about mental health, we need to understand what are the context and what are the factors that is leading the person to be in that kind of condition. So I am just giving one example in terms of money. There are many socio-demographic factors on that basis, on those things which are the basis of discrimination. For example, we can talk about caste. We can't deny the fact that our society is dominated. The most of the power lies within the person who are coming from the upper caste. There are so many measures which is in action to prevent that, but still the situation is like that uh, upper caste people are actually having the most power in this societal situation. And if we consider religion, we can see that the majority I would like to use the word that there are if we consider the current situation, we can see that there is a high tendency to homogenize, or to direct everything towards a particular religion. So anyone from other religion can feel that marginalization. They can. I would like to give one example. May I?
Surely, ma'am, surely. Go ahead.
Okay, okay. One of my friends was talking to me a few months back. That person is not from that majoritarian religion of India, and that person was Muslim. So, he was going to a funeral of one of his father's friends, and that time some people were talking about few things when they're coming back. Some people were talking about few things which was absolutely manifesting the Islamophobia. And that person was when he was calling me, he said that, Sudhanya, so terribly uh, terrible, and I was so much anxious at that situation, that if they ask what is my name, what should I say? Should I say my actual name, or I will use another name, so that I can not be the object of their phobia? We can mention one film here, Mr. and Mrs. Iyer, and there we can see the same thing. So religion marginalization is also impacting a few individuals, because identity is a very integral part of our life. So if we need to think about whether should I say my name here or not, that we can see how traumatizing this can be, and how this can impact in future in the apprehension of fears. So this kind of marginalization related to religion, and other marginalization in terms of ability, in terms of physical ability and mental ability. People who are not, because for example, we can see that all of our institutes mostly are not having that inclusive spaces where a person who is having visual impairment, we cannot accommodate them, because every institute is having the lecture method, or we use the PPTs, we use whiteboards, but that person is not able to see what is written in the whiteboard, what is in the PPT, because our education system is not accommodating them. So we can understand that access to education is a huge thing for our life, but those persons are not actually having this access. We can understand how this can impact their mental health, because education gives us a hope that we can do this thing on this basis of, if we get that educational qualification. They are totally deprived of that. There are so many few, there are not so many but few opportunities for them. We can understand the how physical disability, along with invisible disability, which means mental health related disability, these can also impact, but it is invisibilized and it is unacknowledged. Along with this, there are linguistics barrier, because mostly Indian, because of the colonization and the colonial history, most of the Indian institutes are English dominated. There are so many people who are not trained in English throughout their life, but when they are going to going for their upper higher education or anything, they feel marginalized. I have seen so many students, even myself. Uh, I have so many barriers. Along with this, I have experienced linguistic barrier a lot when I was going for higher education. This is so detrimental for one's mental health. These are the basic structures. There are other things like geographical marginalization, which is mostly rural urban divide. There are person who are coming from gender and sexual minority. These all are the and obviously, being a person, there are so many intersections of their socio demographics, and along with these, when it is accumulated, they become more marginalized. So we can understand that how marginalization can impact one's mental health. And when we are talking about the preventive measure, where we need to work, being a mental health professional and state and other stakeholders where we need to work.
I totally understand and relate, ma'am, that um, mental health is not an individual thing. It is affected by the society and the social factors, of course. And as you said, that the intersection of identities could, lead to the person being more prone to the prevalence of the mental health disorders. So I also have an example. So I had this house help who was working at my place, and in my bachelor's, we were given a project to talk to and interview somebody who belongs to the marginalized caste communities. And I had an interview with her, and she was always very friendly and she gave the interview very willingly. So I discovered about her life eventually as she spoke, how she was maltreated in her own village, how she escaped her village and came to the city, Noida, and how she still faced a lot of problems securing a simple job in Noida just because she used to use her surname. And eventually she stopped using her surname to secure jobs as a maid, like in different households. And also she talked about the intersection of her identity being a female caste minority. So she told me about how her father and her brother were also discriminated in the village, but when they came home, she was the source of where they reflected their frustration, and where she was discriminated by the same men who were discriminated by the society. So I think this was like an eye-opening experience for me to understand the notion of intersections of different parts of identities, and how it has an impact on the person and their mental health, and how mental health is not only an individual factor. So thank you for
Right.
shedding light on this, ma'am. So now moving forward and focusing on the gender and sexuality minorities, I would like to ask you about what are some culturally sensitive approaches therapists can use to address the specific needs of QI plus individuals in India.
Exactly. Because when we're talking about gender sexual minority, uh, we need to, and in the context of mental health, we need to look into the past or history of the diagnostic nosology. Because for a long time, homosexuality was seen as a disorder, and it was today is 19th 17th was International Day against transphobia, homophobia and biphobia, because on that day in 1990, homosexuality was removed from the DSM. So basically, when we're talking about where the marginalization, where this kind of discrimination and where this kind of stigmatization is coming, and this is obviously practiced by because when we are talking about it, we need to know the roots. The roots is structural. What is the meaning of structural? Structure is represented through educational material, law, normalized existing traditional practice. So these are the basic root. There are few many, but these are the basic roots of this kind of stigma, marginalization, practice, and any other thing which actually marginalize a person or a community. So we can see a clear thing that psychology and psychiatry as a discipline is actually holding a structural power, because obviously when we're a bit confused, or when we don't know anything, we obviously uh, search it in a group, in a book, or now we can surf internet. We actually depend on the educational material. So if we consider DSM, it has a huge power to influence people, and it was having that power. And till 1990 it was saying that homosexuality is a disease. Even the latest version of DSM 5 is saying before, not until DSM 5, till DSM 5 it was not stated as gender dysphoria, but DSM 5 is saying that it is gender dysphoria, because gender this paradigm shift happened only in DSM 5, and that shift when homosexuality was removed, that happened in 1990. So we can see that how this mental health discourse was actually a big factor, or the big source of this discrimination and marginalization. So now, what was your question? Can you repeat a bit?
Yes, ma'am. So my question was that what are some culturally sensitive approaches that the therapist can use to address the specific needs of the gender and sexuality individual
Okay,
communities in India?
okay. So there is that we when we are coming from this discipline, there are so many people who read that TSM, and now they're teaching us. So there is a high chance that they are also carrying that notion. I have seen so many people, but it is very unfortunate, but I can still see them that they are saying this kind of thing. And they can they still use the word that ये तो परवर्शन ही है ना, तुम सब कुछ हटा दो, लेकिन एक बार सोचो ये तो परवर्शन ही है अभी, माने they still say this kind of thing. So we need to be very 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 careful when we are getting knowledge, and obviously when we are using it, when we are applying it, we need to be very 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 careful. So this is the basic thing what we need to consider, that we need to be being a mental health professional, we need to be very very much careful what we are learning and what we are implying. And we need to be we need to accept the fact that it is not possible for us to understand everything. So we need to depend on the feedback, we need to invest on the lived experiences of the person from various social locations. So we need to integrate all this knowledge in our practice. This should be the basic thing, and empathy is a so basic thing for each and every mental health practitioner. So empathy must be there, self reflections must be there, because being a cis woman, cis lesbian woman, I am coming from LGBTQI community, but I don't have the gender related marginalization as a trans person. So when I am talking about a person, I need to be very careful, because my cis experience sometimes limits my knowledge. So I need to be very careful what I am saying. I can check it from that person whether I am saying it right. Am I able to understand what you are actually going through? We need to be very much open to correct, for correction, and we need to be very open to lived experience related story. We need to see people who are having lived experience as almost as even we are not seeing them as more than an expert, but we must see them as an expert. That will help us. And obviously we need to, because our psychological therapy and mostly influenced by the western therapy, so we need to contextualize it, because cross cultural validation is sometimes very low. And most importantly, what I must say here, that dominant mental health discourse always say that a therapist must be apolitical, which I think, from my lived experience and from my experience of clinical practice, what I understood that being apolitical is not a thing what um, uh, a therapist must see himself or herself for themselves as. They must be political, because when I can see that, I can say that no, no, I don't want to see your gender. I don't want to see your social, any other social locations, because it is not possible. Because the situation that person is right now mentally, obviously because of their social location. So we need to understand that even we are talking about the therapy space, we need to say, we need to be very careful about the fact that sometimes there are situations where we need to choose the side. We need to choose the side, because where and side, when we're talking about that, we need to choose the side. Which side we need to choose? We need to choose, I must say that we need to choose the side. We need to look through the lens of social justice, because there was an example. It was said by one of a very prominent figure. That person was saying that a person came to him, a girl who was not ready for a child, but her family, maternal paternal both family wants her to be a mother. So, and that time that person, that person was a mental health professional, and he was saying that it was basically due to her phobia related to the medical procedures of pregnancy and childbirth. And what I did, I actually did that, because all of her family members want her to be the mother. So I tried hard, and I just removed her fear, and now she is ready to be a mother. But should this should not be a stand of a therapist, because because we need to see the power structure lies and within the surrounding of my client. We can easily see that even if that person is having phobia, we can talk about it, we can do anything about it, we what we need to do. But when it is talking about, we are talking about the shift of that person's identity uh, from a non-mother to mother, we have so many things to explore before saying that I made her ready to be a mother. Because the patriarchy is actually acting, and if I add my expertise along with this patriarchy, that could lead a horrific situation. So we need to understand that here is the patriarchy playing, and patriarchy is having the most power here. So I need to be with that person who is having the less power. And obviously, she is my client. I need to think about the best interest of that person only, not the best interest of patriarchy. But in most cases, mental health practices are serving, but I'm sorry to say, but it is actually happening in most cases that the psychology is actually serving the dominant structure like capitalism, patriarchy, and anything, and it is sad.
Um, I totally relate with what you said, ma'am. And I myself, I am a cis bisexual person, and I totally related with how you explained about that my lived experiences would be different from a trans bisexual individual, maybe, and we need to consider that amongst the gender and sexuality minorities and marginalized communities as well, along with the notion of being apolitical and how that is not a choice for therapists, and that we are not here to serve patriarchy and capitalism but our clients. And I think that is the most valuable the most valuable advice any therapist could get. And thank you so much for putting that forward. So now I would move forward to religion and caste-based communities. So my question would be, how can mental health services be made more inclusive for religious and caste minorities in India, considering the unique challenges they might face?
Huh. In most cases, when we go with the literature of various mental health condition, we can see but papers are presented like that, that prevalence of this kind of disorder is most prevalent in this religious group. This kind of disorders is most prevalent in this caste community, or this ethnic group. So these are the things. But it is in those literature it is not written that why of it, because I must agree that prevalence is high. It is a fact. We can't do anything with that fact. But what we can do, what we need to think that what is it is coming from. For example, when we are talking about religious minority or caste person who are coming from lower caste, because India is still dominated by, again, I must say that there are so many measures, but it is still there that India is dominated and the most power lies within the upper caste people and majority and religious oriented people, which I don't want to actually use the word. Basically, most I can actually. Basically, India majority of people in India is coming from Hinduism, and they are. And if we consider the current scenario, we can see political scenario. We can see that how. Uh, People who are coming from other than any religion other than Hinduism, in many cases they are being very marginalized. And if we put a data that these religion people coming from this religion is having more this kind of disorder, this can also implicate that it is the characteristics of that religion only, because data are represented this way. But this is not the thing. For example, I was talking about my friend who was having that anxiety to say his name. We can see that how traumatized that person can be. So it is very possible that person have high anxiety level, because it is not his fault, it is not fault of his religion, but the marginalization he is having due to his religion by those who are having more religious power. So being a therapist, we need to be very very aware of the fact. Again, I will be talking about that contextualizing mental health. We need to see the generational trauma that person is carrying within themselves. We need to talk about the his or her or their personal trauma due to this social casteist and dominant religion related discrimination, stigmatization. So we need to be very careful on that fact. And we say that we, as a therapist, we don't need to see the caste class, but when we are contextualizing we must see that. But when we will be intervening, and there we must be very careful that if that person is coming from other religion which is not marginalized, should I deal with the person same way? So we need to be very reflective, and we need to validate their experience of marginalization, because people and dominant structure around them actually saying that they are the problem lies within them. So we need to be very careful. We need to be each and every time we need to validate that your experience of trauma is so true, even if you are not coming from this community, even if you're coming from any other community and face you have an experience of this kind of experience. Anyone can develop this kind of problem, like quote unquote anxiety, depression, and any kind of thing. So we need to be very careful on this ground. That's all, I guess. If I need to add anything, I will add in later.
Yes, ma'am, I totally agree. I think this is the harsh reality of modern India, which needs to be acknowledged. That, a part of a person's personality, maybe their dreams, maybe their aspirations, maybe their experiences of humiliation, they all come from their social identity. And if we do not acknowledge those experiences, then I don't think any therapy could be successful. And if we do not acknowledge those experiences of marginalization, I don't think that we could help them come to the spotlight. So I think that
One thing I want to add here that when we are dealing and talking about being a therapist, being a mental health professional, when we are talking about, or the mental health enthusiast or aspirants, anyone, when you're talking about mental health and marginalization, one thing we must need to understand that mental health related work doesn't always lie within a therapeutic setup. We need to do beyond this, because we need to do policy advocacy. We need to do campaigning where we can talk about mental health related stigma, where we can destigmatize various marginalized groups. So prevention would be possible there. If I am saying that there is a high prevalence of disorder within this community, it is fact. But if we stop there without saying that, no, these are the scenario why this is why they are developing that, and if you are there, you would have developed this kind of thing. So you need to work on destigmatization program for various marginalized communities. Along with this, we need to work on destigmatizing mental health conditions as well. So there are so many work lies within beyond the therapeutic setup, beyond that AC room, beyond that hospital. So we even we need to collaborate with so many people, peer counselors. We need to work with caregivers of the person who are having mental health condition. We need to work with those person who have the lived experience of any kind of mental health conditions, along with psychiatric social workers, psychiatrists. Obviously, we need to collaborate so that actually we can do a very good to the mental health scenario of India as a whole. We need to bridge the treatment gap. We need to go to the rural areas, but obviously we need fund. We need to apply to government. We need to advocate in terms of we need policy advocacy. Actually, we need to do so many things beyond our clinic.
Sure, ma'am. So this reminds me of like a incident. I was attending this course on marginalization and therapy. So there was this person who asked that if I belong to the privileged part of the society, is it my fault, and should I remove myself from the spotlight? So, what the facilitator replied was that as a therapist, your role is not to remove yourself from the spotlight, but to create a safe space within the spotlight for the people who do not have the spotlight, and to facilitate them in your space of privilege. So, I think
Absolutely, absolutely.
yes, so I think we should all keep this in mind as budding therapists and as practicing therapists. And with this, I think we can move on to the next set of questions. So, my next question would be, discrimination and social exclusion can be a major source of stress. So, how could therapists help individuals cope with these experiences? And could you also elaborate on justice informed practices that could be helpful in the context of India?
So basically, I would like to start with the meaning of social justice informed therapy, and then I will go with what we need to do in when we are talking about the discrimination, stigmatization, which marginalized community face. Okay, is it okay? Okay, okay. So, what is the social justice informed psychotherapy? I would like to say that I obviously have a license right now, but when I was in the training program, there are so many therapies. There are so many therapies actually, but social justice informed therapy or the queer affirmative therapy was not mentioned. Actually, we can see that how the structural thing is not ready to include this social justice approach in mental health practices. So, first of all, I think that we need to advocate for social justice approach or social justice informed psychotherapy or therapeutic practices. So, that we need to do. First, I just want to explain what is the basic meaning of social justice informed uh, therapies or clinical practices. That is, social justice means justice is the preservation of rights for everyone. It is the basic sense of justice, that my right is preserved. So I can feel that it's a justice. But when we see that my right, I am deprived of my basic rights, I can feel that justice is not happening with me. So justice is something, it is talking about the basic rights. So what we need to do in social justice informed psychotherapy, first what we need to do is uh, social justice, when we are coming from a paradigm of social justice informed clinical practices, we must acknowledge that there are is many people's mental health. This is the basic or the fundamental thing of social justice informed psychotherapy. Because social just when we are talking about social justice, we need to see that why we need to be social justice informed, because it is not lies within the society. So we need to work on that approach, because due to the social injustice, these conditions are happening in the life of very many people. This is the first thing we need to understand. Then what we need to do when we are talking about social justice informed psychotherapy, then we need to understand that we need to be very responsive to the institutional structural prejudice discrimination towards the people of marginalized group, that it lies there. We need to acknowledge that. We can't say that yesterday I was talking to one client, and that person went to another therapist a few months back. That therapist said to that person uh, that person is coming from LGBTQI community, and the therapist said to that person that it's okay, you are coming from that person, it should not hamper your study, it should not hamper your daily process. Why are you being so much obsessed with your identity? Because they are not actually acknowledging the inequalities or the discrimination stigma that person is experiencing from their childhood. So this should not be the approach of a social justice informed psychotherapist or the clinical practitioner. So they need to be very aware of the structural inequalities, and they need to question their own biases and the own which is coming from their privileges. Because that therapist was a cis-het man, so obviously he was more privileged, because his sexuality is not actually impacting him, or it is not impacting his mental health detrimentally. But it is not the client's experience, because the client's sexuality and client's gender identity is actually a huge thing, for which the social society, because society is not actually doing what is needed to be done. So that person is face so many things, and by saying this, the therapist is actually adding more stress to the life of that client. So the social justice informed therapist or clinical practitioner must be very aware about their biases and their privileges. Okay, and they need to do the justice advocacy, as I mentioned, that they need to justice advocacy, social justice advocacy in terms of a preventive measure, and in terms of destigmatization campaigning and all this, and policy advocacy. Because when we're talking about the class related marginalization, uh, if there are I must say that mental health care act is a wonderful act, I must say. Because when we are talking about India and its condition, and we are seeing mental health care act, I can obviously say that mental health care act actually gives me a huge hope. But the problem lies within the dissemination of the policy and the implication. Because when we're talking about the person who is coming from a very lower class and not able to access any kind of mental health care, the mental health care is saying that the government should take care of it, even if that person needs to travel to another district or anywhere. Government should reimburse that money also, along with providing all the facilities. But when we were practicing in Rajabaja Science College, and the people who were coming from various rural areas were not actually aware. So I think when we are coming from social justice informed therapy, we need to very prompt in our action in terms of distributing distributing the knowledge, distributing the resources which is available to the people. So we need to do that campaigning. Even if you get a chance to talk to any random people, just talk about the policies which are available for people in the context of mental health and any kind of thing. That I think that it is a social justice informed practice. And other thing, we need to consider again that the inequalities are there. We need to acknowledge that, and we need to look and explore the reasons behind the inequalities. And I think it also covered your another question regarding that stigmatization.
Yes, ma'am, you did. So I totally agree about the implementation part. That no matter how many policies we have, if we don't implement them correctly, if we do not advocate for them correctly, I don't think that the change could come, because the right to equality has been there in the constitution since so many years. But do you think equality really prevails? So yes, implementation is totally necessary, and I also wanted to add on the part of being a therapist and being social justice informed and affirmative. So I just read a post on LinkedIn yesterday only, which sat with me, and so the post was that if you're a therapist and you're cure affirmative and you're social justice informed, and you have all of it in your bio, like it's some achievement, right? So isn't this something like a humanly quality that you should have inculcated since the very starting? Is it something that you need to show off that I am social justice informed and treat people equally?
Exactly, absolutely, absolutely. I agree with you. One thing I must want to add, because social justice informed practice is very much rare right now. That's why I think we need to, because uh, the thing is, sometimes when we are talking about the activism, and when we're talking about the activism which is class struggle related and which is actually anti capitalist, but sometimes people need to campaign through social media, which is also part of capitalism. So sometimes I think, considering the, because we need to strategize if we want to achieve something as a whole, we need to sometimes strategize. So sometimes we need to, I must say that this kind of thing, we will not say that I am doing a huge thing by doing this, or it is something that is that we must be very, we need to be very clear about our intention. Why I am doing this? Do I doing this just because people will say that Baba, that person is doing so great thing, or whether I am just want to do it for, so that people can even that person is any random person is seeing the thing, the social justice info in anyone's bio, and that person may be a mental health professional, any other one, and go to Google and search for the term social justice informed, that can actually help the scenario. So we need to be very clear about our intention, and sometimes actually which we can broadly refute, but sometimes when we're strategizing, we need to integrate few things which we actually don't want to, but we need to.
I totally understand your point, ma'am. When social justice information is so rare, we need to advertise it somewhere or the other. I totally get your point, but I just want to state that why is it rare? The
That's
frustration that it should not be rare.
that should not be there, but it is due to structural things. Obviously, there are so many things which should not be there, but it is there.
Exactly. And, us as psychology students, we've been rote learning the definition of empathy since years and years. Or sabse pucho, everybody would know the definition by heart, but I think this is where they should actually apply the definition of not just being informed, but also knowing their experiences, feeling their experiences, and putting them into practice.
Absolutely,
Um, So I think we are running out of time.
absolutely.
So I would just come to my last set of questions. So there's a significant shortage of mental health professionals in India. How can we bridge this gap and make services more accessible for marginalized communities, particularly in rural areas?
We need to implicate policy first. There are so many good things which was written in the policy. We need to implicate. We need to work on the implication of the policy first. We need to work with other stakeholders, and budgetary allocation needs to be increased, because the provision is that every primary healthcare setup must have mental health care setup, but it is not there. It is not everywhere. The reimbursement policy was there, but it is not actually happening. So we need to focus on the implementation, and budgetary allocation must be increased. We need to do policy advocacy so that government do that. Policy advocacy must be there. And oh, one thing that there is a huge scarcity of mental health professional right now, because when we are I was going through a few statistics, and I want to share one thing, that the latest mental health survey was published on 2016 mental health care survey. And when we are talking about West Bengal and status of clinical psychologists, in the year of 2015, there were only 42 clinical psychologists in West Bengal. We can understand how pathetic the scenario is. But till I was going through another article where I noticed that currently there are 3,700 something clinical psychologists available in India. We can see how I am just talking about the clinical psychologist. There are the same scenario happens with the, for the psychiatrists, social worker, psychiatric nurses. So when all of us and many of us actually can relate that when we were thinking of doing our MPhil, we can see that how we were scared whether I get the chance or not, because there are so many limited seats. These seats must be the training program. This isn't just training program. These seats must be increased so that we can get proper more, so that more people can get the proper training. And along with this, I must say that I always advocate for ethical practices and license practices. I always advocate for that. I will always say that when we are going to a physician, and we always say we always see what are the qualifications of that physician, specialization, anything other than that. So when we are talking about mental health professional, we must go with that. Obviously we need to do that. We need to do ethical practices, we need to get the license. All of these are fine. Along with this, we must agree that beyond this clinical practice, beyond this license practice, we need to collaborate with so many people. With who are those people? Peer counselors who are having mental health uh, lived experiences with many various mental health conditions. What we need to do, there is a huge problem of hierarchy within this discipline that is actually creating the whole mess, because there should not be any hierarchy. I, being a clinical psychologist, I will do my work, and that peer counselor will do their work. What they need to do, what I need to do, because according to mental health care, and we, as I gone through that rigorous training of MPhil, I can understand there are so many specific techniques, etc., which one needs to know. But that peer counselor must not have that knowledge related to the specific therapy. They don't have to actually. But what they can do, they can work with. We must not use that under supervision. They can work with the supervision of a licensed practitioner. There should not be any hierarchy like they are working under this person, not this under this person. So there must be a parallel collaboration between so many stakeholders for mental health professional, with person who have lived experience with mental health condition, who are the caregivers, and various leaders, political and any other leaders with good intention, any teacher, professor, uh, any community worker. We need to work collaboratively so that this scarcity can be addressed and the scenario of mental health in India can be but that sustainable goal said that these things must be elevated, and so that we can reach there by 2030. And obviously, as a whole, we need to go there without any deadline.
Thank you so much for this answer and shedding light on all of the relevant topics that you covered, including the ethical practices. And oh my God, I cannot emphasize enough on how we need to ask people about their qualifications and if they are qualified enough to give advices on social media. I think nowadays popularity is the only qualification for being a mental health,
Exactly,
advocate
sadly,
of
but exactly so.
and collaborative care, of course. So thank you, ma'am, for answering
One thing
this.
I
And
say that when we're talking about community work, we must say that psychiatrist social worker can do a wonderful job, which a clinical psychologist cannot. So we need to work collaboratively, and we need to understand that we all are parallel. There is no hierarchy. Okay,
exactly.
please carry on. Sorry to interrupt.
No issues, ma'am, no issues. I love listening to you. So the last question would be that the stigma around mental health can prevent people from seeking help. So, what
Absolutely.
can therapists do to address the stigma and create safe spaces for open discussions?
Oh, that's a very nice question. Actually, I have so many things to say about this fact, this scenario actually. So I will try to make it brief. So actually, uh, when uh, 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 when we were still, I am a student of psychology. Obviously, we all are. But when I was in training, it was like that. Mental health condition is a myth for mental health practitioner. That is just a myth, and that is just a thing which they work with. But the reality of mental health condition of a mental health professional is never visibilized, because it is always in that they are the service provider, so they don't have that kind of problem or issues or mental health conditions. So first of all, being a mental health practitioner with a lived experience of mental health condition of depression, and I had a non-fatal suicide attempt, but I was in 3 days. I was in ICU for 3 days. So I must say that being a mental health professional, we must acknowledge our mental health condition, and we need to talk about it more. And we need to say that this was my reality once. Which reality you are going through right now? This was my reality. It is not like that I am coming from a very calm and composed position. That is why it is a very distant thing. No, it is not. It can happen with anyone. So this thing can this can be an approach. I have seen so many therapists saying that I don't feel any burnout. No, no, no. There is no burnout. No, I am that. No, I can balance everything. This is so. Actually, this is the manifestation of stigma. They don't as I said that we need to be very self-reflective before being therapists, we need to see our mind like this. So we need to be very vocal about our mental health condition. We need to be very, very, very. When I can say, when people are coming from various marginalized position, yeah, it is said that we don't need to share our identity, but I have seen that even a person who is trembling and feeling very hesitant and saying that I am coming from LGBTQI community, and at the same time when I am saying that I am coming from the same community, they feel relaxed. So when we are talking about mental health, sometimes I am not saying that, see, I am not saying my mental health related condition to get help from them, or I am not abusing my power of expertise so that they can help me. No, I am not saying this. We need to be very clear about my intention. Why I am refilling my mental health condition related history. We need to be very cautious that my intention is that person can feel that, relate, and can feel that that person may understand, because that person may have this similar experiences in her past. I think this must needs to be there, and obviously uh, campaigning needs to be there. Campaigning and this revelation actually helps, and we need to first of all, I think being a therapist, for first few sessions you just need to validate. You just need to validate with boundary, obviously with boundary, because the training of boundary you have within yourself, but you need to validate the experience, and you need to destigmatize mental health when you are comparing it with physical health. And we need to be very, very careful when we are talking random things. There is a huge practice within people. If anything happened which is not going with the norm, or which is not anything which cannot provide any benefit, they said, why are you doing this like a crazy person? Because this actually creates a huge stigma about mental health. We need to be very careful about using this, because the word crazy is not a slang or bad thing. We need to be very, very careful about what I am saying, what we are talking about. These are the basic things, and any are if you ask a few other measures, you can we need to talk about. We need to, that are a few things that we talk about mental health, but when one of a very close person is talking to their mental health, we people say that are kichu sorry, that will not help, just go with the flow and nothing will happen, don't think too much. We need to normalize the discussion about mental health too. Okay, this, I think this would help to destigmatizing mental health as a whole. And campaigning needs to be there, and all other barriers for language barrier, any there are many as a service provider, we need to be very, very we need to have a training on how to deal with our existing prejudice and anything. I think that's all we need to do.
I totally agree with you, ma'am, that the therapists do need their therapists, and we are not some, relentless saviors. I think
Exactly.
to connect with humans, we need to embrace our humanity first, and put our mental health and discuss about it with people around us and start a conversation. I think that would be the first thing. Start a dialogue around mental health and let people know that this is also an important issue.
So that they can break their closet of their mental health condition.
Exactly, ma'am. It takes only, I think I've seen this in my experience, that it only takes one conversation to bring something out of the other person.
Absolutely, absolutely. Exactly. I must say that people say that I don't know whether when they are referring clients to me, they say that I don't know whether that part, but she or he or they will say things to you. I don't know, because that person is very is not very open. But in most of the, in all of the cases, not most, all of the cases, I have seen that they're very open. They were just waiting for an opportunity to talk, which you are actually saying.
Exactly, ma'am. So after having a very, very insightful conversation, which I thoroughly enjoyed, I must say, I am not supposed to choose favorites, but I think this was one of my favorite podcasts, and I think I just hope that we could, have some more time, continue this conversation someday, and collaborate again. I feel. So thank you so much, ma'am, for enlightening us, for giving us your insights, and for holding this conversation with me. Um, and I would also like to thank all the viewers who are present here and who would be watching this podcast on YouTube eventually. Your support and engagement fuel our passion for creating meaningful content. And remember to stay connected with us for more exciting podcasts on the horizon.
Thank
Thank
you,
you so
Radhika.
much.
Thank you, all the participants. I can see so many familiar and supportive faces. Thanks to you all.
Thank you, ma'am. I think you deserve it all. You deserve all the support. And thank you for being a guiding light for all of us.
Thank you.
So we are ending the meeting, and you are free to leave now. Thank you.